My feet are tingling. They feel tight. I know it's my MS, but what am I supposed to do?
Have no fear, future Lawn is here.
Wait, in the future, did I become a doctor? And like, why do I have an accent? Wait, did I study in England?
Oh, no, I guess is this it's a little misleading? Not a doctor. And if I'm still me, but just me in the future, I don't know why I have an accent suddenly. So, okay, we're going to drop the accent. I just wanted a fun way to be able to tell you that I've been in your shoes. I know what it's like to have tingling feet in those shoes, and I've come through on the other side. And here's some things that I have tried that I feel like really helped along the way. So today we're going to talk about red light therapy. So I'm going to be doing more videos, talking about more things I've tried. If you haven't already subscribed, now is the time. So let's begin. Zoe, you're going to make it very hard for us to edit this. When I first heard about red light therapy, I kind of thought it was bogus. I remember I went into this place. It's called Restore. It's actually kind of like a playground for health nuts. They have cryotherapy, red light therapy, compression, IV drip therapy, mild hyperbaric oxygen therapy. They have so many different things that I can't even list them all. But when you go in and they give you a tour, you see all these different rooms with all these fun different things. Well, I call them fun because I really am into health. These different ways that you can heal, either like maybe your muscles are having an issue, or I mean, just really anything. It's all connected. They offer a lot of things that you don't really see anywhere else. And that was the first time that I saw red light therapy. And when I walked into that room, I kind of thought it was a joke. I was like, okay, I was with you on everything else, but there's just some red lights. What's that going to do? And now I feel kind of stupid because I've done all this research. A lot of other people are starting to wake up to the benefits of it. So again, big disclaimer, not a doctor. In fact, I'm going to take off this white, suit coat. This is just misleading. It just, it was for the joke, guys. In fact, let me just pull up my chair over here, get comfortable with you. Oh, now I'm all the way down here. Hold on. Is that good? No, that's not good yet. That's still kind of high. I'm using my husband's office today because I wanted a change of pace for you guys. And I feel like the books look so medical. When I was having this flare up, I was thinking, what are the different parts of the body that I know and understand from my massage therapy, understanding the body? Like we had to learn every muscle, every bone, every system. And I thought, this is something that's figure outable. And I feel like there's a lot of times that you go into the doctor and you ask a lot of questions. They give you very simplistic answers. They're not trying to really educate you and teach you a lot. I mean, maybe if you have a great doctor, which is awesome if you do. But for the most part, it's just like they want to give you a pill and get you out of the room and, here, hope that fixed it. But I really wanted to understand what is going on when I'm having a flare up. So I thought it through. I'm like, I know that what's going on is my brain is sending signals down to my feet and down to my legs that are incorrect. I know that it's because the nerves have the myelin sheath, and the myelin sheath is being not chipped away, but it's being removed. So I have a little bit of knowledge of like the nerve pathways. If you've ever seen like a chart of the body, it's basically, well, they're basically everywhere. So I knew that this was what was wrong. Okay, it's the nerves down in my feet, particularly, and it's also the message from my brain. But I thought, what if I could heal my nerves? And when I did some more research, I found out that nerves are the slowest healing tissue in the body, which is really frustrating because I'm like, really? That's our main problem. And that's going to be the thing that's the slowest healing. Okay, well, it makes sense why some of us will have a flare up for like a month or 2 or 3 months, and they only heal at 1 inch per month, which if you think about how long your legs are, well, for most of us, they're several inches. So the cool thing that I learned about infrared is that it can heal your nerves up to 4 times faster. So this is all according to my research I did. And a lot of it did come from the Nerve Doctors channel here on YouTube, which I'll link below. They are actual doctors, so I think that they know what they're talking about. It all seemed to check out with a lot of the other research I did though. So the other cool thing is that red light therapy actually isn't that new. It's just starting to gain popularity. It's actually been around for quite a while, just like a lot of these other therapies. But in 1961 was the first use of laser medical surgery, which is also called photobiomedical modulation. It's the same thing. It's just that's the official name these days. When you look it up in like a medical dictionary, we call it red light. That's kind of more of the layman's term. And then infrared light therapy, which is similar but different. I'll talk about that in a second. But the main thing that I think you might want to know is that not all red light therapy actually goes deep enough to hit the nerves.
So it's super important that what device you're buying actually is going to be the right levels to actually reach the right levels in your skin. In the video I'm going to link below, they go over the science and they have a lot of awesome graphics and they really get deep into it. But I'm going to go like at a high level. So like I said, there's red light and there's infrared light. So what's the difference? So red light is between 620 and 750 nanometers, and it's visible to the naked eye, and it helps healing the skin. So this is something that's going to affect you at a top level, surface level kind of thing. It's something that you might see a lot of on Amazon, face masks that are red light therapy to like make your skin look better. And I'm not saying it doesn't, it's just what we're looking for is something that's going to go a little deeper, which is infrared light. So infrared light cannot be seen by the naked eye, and it goes between 800 and 1100 nanometers deep. It also goes about 1.5 inches deep into the skin. So when you think about anatomy, how deep are your nerves? I mean, they can probably be much deeper than 1.5 inches, but if we can go that deep, that's going to affect more than just skin level. Okay, so now that I had done some research, I felt like I was informed enough to go ahead, buy one of these devices, try it out for myself. Now, I didn't buy the one that they were suggesting because it was a little bit of a pricey purchase, but I went on Amazon and I looked for things that met enough of the requirements, which I'll go over in a second, in order to get one that was a little more affordable, considering I still was skeptical about if it would work. So I got this one. It was just about $30 and it met enough of the requirements that I'm like, let's give it a go. And what I did is I just wrapped it around my feet, and I did this on a daily basis for, I think it was about 20 minutes each. It does have some disclaimers saying don't do this for like an hour or something, because the more that you do it, the more that you are taxing your body. Just like any medication, too much of a good thing can be a bad thing. So don't go overboard. Oh, and if you are going to get one, there's a few things you want to pay attention to before you purchase it. So remember that I said that red light only affects the skin level. Infrared light is what you're looking for. Make sure that it has infrared, and that infrared is going to be between 800 and 1100 nanometers. I don't know what a nanometer is, but it's a measurement that is important for this. It will most likely also have red light, and so the red light should be between 620 and 650 nanometers. Also, there should be twice as many infrared diodes as there are red diodes. So a diode, I would assume, is this little dot right here. Here's the device that I got. This is just as iThera, the smiley face. I'm going to show you when I turn this on. Okay, I'm not going to look at it because if you're looking at it with the naked eye, it's probably not the best idea. I'm showing you through the camera, so it's probably fine. So all those are the red lights. What you can see is the red light. What you can't see is the infrared. And with this one, there's also a timer. There's different levels. I'm getting brighter or darker. Oh, but we can set it on this one. You can do 660, 850, all. All is probably with infrared. There's a timer. There's a way I made it blink. Oh, there we go. There's the blinky. And it is nice and flexible, as well as this part can come off, which is nice because then you could clean it if, you put it on your feet. You might want to clean it from time to time. I mean, it's very flexible. Like if you had a shoulder injury, you could put it there. If you had a back injury, has a very long cord to be able to move it around. And here's the little dial. So there's off, all, 10 hertz, 660, 850, it looks like. And then there's the timer here, and level 1, level 2, 3, 4, level 0. So it has several different settings, which is nice. Very few of the ones that are sold on Amazon actually meet these requirements. A lot of them are just meant for skin level, or I don't know, they might not even be good at all. Look at the numbers that it has in the description, pay close attention before you buy one, and give it a try. So what I found after doing this for a few months is I really do think that it helped. I also started using it a little bit on my back. I think I was having a little bit of lower back pain at the time, but I do think that this, in combination with several other methods that I tried, which I will be talking about in my upcoming videos. So if you didn't subscribe, that's why I want you to. Those are the things that I think helped me to clear my flare up faster and to feel better, to feel like I was in more control. And it was not an overnight quick fix thing. So I wouldn't say get this and expect to put it on one day and the next day be healed. So because I wasn't being super scientific about it and like having controls and like not trying any other therapies and just trying red light therapy, I can't say like this was the thing that made it totally work. Whereas there have been scientists who have actually done that, and I would refer to those studies over my experience. But as someone who has MS, I think that it's something that is worth at least the $30, if nothing else. If you can afford to get the nicer one, and if you are in more pain, it might be really worth it. Maybe your health insurance will cover it or something along those lines. But overall, I vote yes on doing red light therapy. So I hope that this helps you to kind of guide away from something that's just going to be a waste of money versus something that might help. And then if you want like the most legit thing, obviously go with the expensive one that's on this guy's website. Overall, I think go ahead and try his $30 one. Let me know if you feel like it's helped you. And if it doesn't, let me know that too. But I would say try to be very consistent with trying it every single day for, 10, 20 minutes. And if there's any natural healing methods that you've tried, please list them below. Let us know, because when you share that, it helps the community. And I figure if this helps just one person, that's worth it. Also, if you have ever had any problems with optic neuritis, so if your eyes have all of a sudden gone blurry, or you have double vision, or you just can't see and you've never really had vision problems before, it could be your MS. I'm not diagnosing that. I'm just saying that's something that happened to me. I have this video here that talks about my experience with optic neuritis, and it wasn't fun. And I'm very sad to see that several people are watching it, because that lets me know that probably several people are experiencing it, and it's just not fun. So I talk about the different things I did to help heal that. And if that doesn't help, then I also have the video that is all about healing MS naturally, that talks about a lot of other methods, and I'll keep them coming. So just let me know if there's something you want me to try, and I will do a video about it. Hope you're having a great day. Sending you healing thoughts and prayers and vibes, and I'll see you on the next video.